Talking with auxiliary medical personnel in hospital. I'll take my round at 10 o'clock in the morning. Today, I'll accompany me during the round. Prepare the patients for my round. See that all the patients stay in their wards. Put the case history on patient beds. Let's make the round, please. We begin the round with the cardiology department. We begin the round with the nephrology department. The purpose of patient-centered board is to have the head nurse know the number of patients in the wards, their names, their diagnosis, and their bed number. This board also has the ward personnel to know the number of empty beds. It has the head nurse to write exactly the patient daily situation sheet. The head nurse uses this sheet to assign her personnel and students. Name, age, and hospitalization date of the patients, as well as the diagnosis, must be up to date and must be written at the exact bed numbers that they occupy. How many patients are there in the department today? Is the department full? Are there any vacancies? How many patients have been discharged from the department? How many patients have been admitted to the department? Has anybody died this night? Please give me the number of patients admitted and discharged this month. Show me the case history and the ward charting of this patient. How does the patient feel? Is he better or is he worse? What's his temperature? What was his temperature last night? Has he had fever? How did the patient sleep? Well, badly. Does he sleep after dinner? Has he been delirious? Did he have stool? What was the stool? Did he pass this water? Did he urinate? Mud? Has she stopped vomiting? Did she cough in the daytime? Did she cough during the night? At what time did he have an asthmatic fit? At what time did he have an attack of convulsions? Has his diarrhea stopped? Has the patient eaten anything? What has he eaten? When did the bursting of water stop? Are the labor frequent? Did the relative of this patient visit her? Did the relatives of this patient come to visit her? Did the patient bathe? Did he take a shower? Did you wash the patient? Has he had his X-ray made? Has he had electrocardiogram made? Has he had blood color index made? Show me, please, his cold X-ray picture. Squint on the X-ray film viewers. Have you sent the demand for gastric truth analysis to the laboratory? Please ask the laboratory assistant to come to the ward in order to take blood for analysis because the patient must stay in bed. Tell the patient to take his stool for analysis. Explain to him how to do it. Has he been consulted by the gynecologist? What's the conclusion put in the case history? Has he been examined by our ophthalmologist? Have you shown him to the TB doctor? Ask the surgeon to consult the patient for his rhombophlebitis. It's necessary to call the neuropathologist for consultation once more. It isn't urgent. It isn't an emergency. Work up the patient. Carry away the patient. The dermatologist can examine this patient tomorrow. This woman will give birth to a child. This woman will soon be in labor. Let them accompany her to the maternity hall. This patient must be laid in an isolation ward for contagious patients. This patient must be moved to the surgical department. This patient suffers from paralysis, a chronic disease. He must be laid in a care house. These children abandoned by their parents are to be laid in an orphanage. What is his prescription? What does he receive? What drugs does the patient take? What drugs is the patient taking? What antibiotic does he take? Is the child given any tonics? Have you given him an enema with chloral hydrate? Have you made for him a gastric lavage? Discontinue to give him chloramphenicol. Don't give him more chloramphenicol. Cancel mycotoxin. Continue paracetamol. Continue the same prescription. The fever subsides. ESR is becoming normal, so the dose of prednisolone may be reduced now. The patient has considerable anxiety, dyspnea, and displacement of the heart, ectopia. These are direct indications for neural puncture, neurocentesis, after my brow, or make a puncture. Make a bloodletting of 300 ml. Make a ligature of the umbilical cord. Give him 3 drops into the eyes, the ear, the nose. Apply cups to the patient. Apply mustard splatters on him. Give the patient a hot water bottle. Give the patient an eye bang. Give the patient an air ring. Give the patient a bedpan. Give the patient an enema with glycerin. Give him a siphon enema. hold the irrigator higher. Thank you for watching.